Hello, and welcome to our third annual virtual APA assessment community gathering to celebrate our wonderful student poster award winners. My name is Emily Shaw, and I'm from Division 5, and I'm thrilled to be here today with my colleagues David McCord from Division 12, the Assessment Psychology section, and Katie Block from Division 40. At each APA annual convention, the assessment community hosts a breakfast co-sponsored by various assessment organizations and our 3 divisions, where we come together to connect and honor students who have done outstanding research in the assessment field. After a 3-year hiatus, we are thrilled to be able to connect in person again in Minneapolis at this special breakfast meeting. But we've also decided to continue, at least for now, an online and very accessible way to honor our assessment community student poster award winners. David?
We would like to briefly recognize our test publisher sponsors this year. Their willingness to provide the funding for the $250 awards for our 3 winners, for the award certificates, and for the really nice and really expensive breakfast buffet at the APA convention is what makes this event possible. Their generous support allows us to recognize 3 very impressive research projects with students as principals, sophisticated, substantial projects that contribute meaningfully to our field of assessment psychology. So we ask that you just take a minute to consider how important our publisher partners are in our assessment work. And we want to personally express gratitude to the individuals who served this year as our contacts for these publishers. Sarah Arzipa of MHS Multi-Health Systems. Kelly Kyson of Pearson Assessments worked with us during the winter and spring in the planning stage, and Pearson Vice President Clay Ritchie will be attending the live breakfast event at APA. Stella Rocablave of Riverside Insights, and Dr. Dave Hertzberg of Western Psychological Services. I want to recognize that these 4 publishing partners have been with us steadily for many years, day in and day out, including the challenging 2 years of the pandemic. We could not afford to have this event without their generous support. So, Dr. Block, would you like to introduce the winners?
Of course. So I'm really excited to be here today, and congratulations to our award winners. We have 3 excellent candidates, although it was very hard to pick because we had a number of really wonderful submissions across all of our divisions. But after much discussion, we were able to come up with 3 that we felt like really represented the spirit of this event and psychological science in assessment. And so our first winner representing Division 5 is Haring Lee from the University of Iowa with the presentation entitled Score Consistency for the BFI versus BFI2 Scores from Conventional and G-Theory Perspectives. And representing Division 12, the Assessment Psychology section, we have Michael LeDuc from Texas Tech University, who will be presenting on a psychometric evaluation of the interpersonal hopelessness scale. And last but not least, representing Division 40, we have Katie Hodges from the Palo Alto VA Medical Center, who will be talking about the role of PTSD in subjective working memory and objective cognitive performance in veterans with traumatic brain injury.
Hi, my name is Haring Lee, a PhD student at the University of Iowa. I'm presenting this poster with the help of my co-authors, Dr. Walter Bispo and Dr. Harry Hong. Our presentation is titled Score Consistency for BFI versus BFI2 Scores from Conventional and Generalizability Theory Perspective. Over the last 30 years, the Big 5 inventory has been used in thousands of studies. More recently, Soto and John developed an updated version of the BFI2. However, direct comparisons of the reliability of domain scores from the 2 instruments is quite limited. In the previous study, conventional reliability estimates like alpha, omega, and test retests were only reported for the BFI2. These conventional reliabilities are based on a single source of error, while G-theory can quantify multiple sources of measurement error simultaneously. So the purpose of the current study is to provide a comprehensive comparison of the reliability of BFI1 and BFI2 scores in relation to both conventional reliability and G-theory-based reliability. In this study, 3 college students participated in the questionnaire survey 2 times separated by a week. The results indicate that most of conventional reliability indices were higher for VFI2 than for VFI domain scores. Meanwhile, most GTR reliability coefficients were higher for the VFI for agreeableness and conscientiousness, and higher for the VFI2 for negative emotionality and open-mindedness. For extraversion, univariate reliability indices are nearly identical across instruments, but higher for the VFI and the multivariate analysis. In most instances, multivariate G-theory analyses show lower specific factor error and random response error than in univariate G-theory analysis. So to conclude, both BFI and VFI2 produce solid evidence of score consistency. But the BFI2 does not provide greater consistency for all domains as might be anticipated. And for all 5 domain scales in the BFI and VFI2, each source of measurement error account for noteworthy proportion of observed score variance. This result highlights that multiple measurement errors need to be taken into account rather than relying on conventional indices. Across both instruments, multivariate G-theory indices typically yield higher reliability. Therefore, it is important to incorporate information about basis score interrelationships when estimating reliability for domain scores. Thank you.
Hi, everyone. My name is Mike LeDuc, and on behalf of my colleagues, I'm happy to present our work investigating the psychometric properties of the interpersonal hopelessness scale. The interpersonal theory of suicide proposes that thwarted belongingness, a state similar to loneliness and isolation, and perceived burdensomeness, or view that one is a burden onto others, coupled with hopelessness about these two states changing, produces suicide ideation. The hopelessness specific to these two states, or interpersonal hopelessness, is unmeasured in a leading assessment used to test the interpersonal theory, the Interpersonal Needs Questionnaire. Dr. Tucker and his colleagues created the Interpersonal Hopelessness Scale, or IHS, to address this issue. Earlier psychometric evaluations using exploratory factor analysis have suggested the interpersonal hopelessness scale measures a unitary construct rather than two. We evaluated the IHS's construct validity using confirmatory factor analysis, directly compared 1 and 2 factor structures, and examined concurrent validity and reliability. Our sample was 595 adults recruited through Qualtrics panels who passed attention check items and endorsed past year suicide ideation. Our sample's average age was about 36 years old, and about 55% of our sample were cisgender women and 70% white. Participants completed several measures, including the Interpersonal Hopelessness Scale, which is a 10-item measure using a 5-point rating scale, and the Beck scale for suicide ideation. Using M+, we performed confirmatory factor analyses with IHS items modeled as categorical given the measure's ordinal scale, and a chi-square difference test revealed a 2-factor model, interpersonal hopelessness about thwarted belonging, or IHS-TB, and interpersonal hopelessness about perceived burdensomeness, or IHS-PB, fit the data significantly better than a 1-factor model. Bivariate correlations between both factors and other suicide risk and protective factors were significant and in expected directions. For example, hopelessness about IHS-TB was positively correlated with loneliness, whereas IHS-PB was negatively correlated with optimism. Next, using hurdle-negative binomial regression, results showed that IHS-TB and IHS-PB, when modeled together and independently, were significantly associated with the presence and severity of suicide ideation. Finally, Cronbach's alpha, McDonald's omega, and average inter-item correlations were all high for IHS-TB and IHS-PB. In summary, the interpersonal hopelessness scale appears to have a 2-factor structure and is significantly associated with the presence and severity of suicide ideation, consistent with the interpersonal theory of suicide. Results also demonstrate evidence of its strong concurrent associations with related measures and excellent internal consistency. Our efforts suggest hopelessness specific to feelings of lack of belonging and burdensomeness appear to be distinct constructs, and if assessed together, could improve suicide risk assessment. Thank you very much for your attention, and thank you for the honor of the Assessment Community Student Poster Award.
Hello, everyone. My name is Katie, and today I'm going to talk to you about my project titled The Role of PTSD Symptoms on Subjective Working Memory and Objective Cognitive Performance in Veterans with Traumatic Brain Injuries. So veterans are identified as being high-risk population for experiencing post-traumatic stress disorder as well as traumatic brain injuries. Individuals with traumatic brain injuries frequently report cognitive impairments or difficulties, and yet there are limited studies that have examined the relationship between an individual's subjective report of their cognitive impairments and their objective neuropsychological performance. As such, the goal of our study was to examine how traumatic brain injuries affect not only objective performance-based cognitive functioning, but also subjective functioning, with a specific focus on whether symptoms of PTSD, as well as the type of brain injury, can affect this relationship. So we had 36 veterans that reported a traumatic brain injury that they sustained during deployments. Of those veterans, 11% were female and 18 met the criteria for clinically significant levels of PTSD symptoms using the PSAL cutoff of 45. All the participants completed a measure to assess their subjective working memory, which was the behavioral inventory rating of executive functioning. To measure their objective working memory, we used the Wilshire Adult Intelligence Scale. We then ran a Pearson correlation to analyze the relationship between subjective and objective working memory. And then a regression analysis was conducted to determine the predictive value of type of TBI, specifically looking at a blast versus a blow to the head, as well as the predictive value of clinical PTSD symptom levels on both subjective and objective working memory functioning. We found reports of working memory impairments did not correlate with objective performance deficits. However, we did find that subjective working memory complaints significantly correlated with PTSD symptoms. To summarize, among veterans with a history of brain injury, those with clinical levels of PTSD symptoms were more likely to report working memory impairments or difficulties. However, these complaints did not translate to working memory deficits on objective measures. This disconnect between subjective and objective working memory highlights an area for clinical interventions, specifically providing a treatment plan that targets subjective complaints among those with PTSD in order to improve a veteran's awareness of the cognitive abilities and ultimately enhance the quality of care that we are providing. Please refer to the poster for all of our other considerations in the study, which include results of additional analysis that we ran and our limitations and some of our future directions. Thank you to the veterans at the Palo Alto VA for their participation in this research, as well as members of the MIRAC and Risk Research Centers at Palo Alto for their contribution. Lastly, I'd like to thank the members of APA assessment team for this award.
We'd like to thank our 3 fabulous poster award winners for sharing their work, and we thank all of you for taking the time to listen and learn with us today. We hope to see you in person at the APA Assessment Community Breakfast at the annual convention. This will take place on Friday, August 5th, 8 a.m. to 9:50 a.m. Central Time at the Hyatt Regency Minneapolis, the Mirage Room on the 2nd level. And please keep those Division 5, 12, and 40 assessment-related student poster submissions coming our way. Thank you.